Now let's take a look at a 911 call from the very beginning. We've included the dispatcher and what the dispatcher actually asks the patient, with the patient responding back to the dispatcher. Take a look and see the interaction between both the dispatcher and the patient, how long they spend with the patient, and the different kinds of questions in which they ask.
911, what is the address of the emergency?
Street.
Thank you. For verification purposes, repeat that address.
2
Phone number that you're calling from?
81.
What city is that in?
Clearwater.
Okay, tell me exactly what happened.
It's just I've been sick for days, and now I got arm pain and leg pain. It's hard for me to move.
Okay.
Oh.
All right, sir. My name is Andrea. I'm going to gather some information. How old are you?
40.
Okay. All righty.
I really don't feel good.
I understand. I'm going to get you help as soon as possible. Just I need you to stay on the line with me.
Okay.
Okay. All right. And are you having chills or sweats?
Yes.
Okay. All right. I am sending the paramedics to help you now. Stay on the line. I'll tell you exactly what to do next.
Okay.
All right. If possible, please come to the front of your house for handoff to EMS, unless doing so would be harmful to you or disrupt any critical medical interventions that you're taking place. This is an infection control measure. EMS responders are screened daily for COVID symptoms and may be arriving in full PPE.
Okay.
Help, just let me know and tell me when the paramedics get there, okay?
Okay. Just it's hard to breathe.
It is hard to breathe?
Yeah.
Okay. Let me let them know that so they can upgrade their response, okay?
Okay.
Okay. I have now updated them, and they are responding emergency. If anything else changes, just let me know.
I'm just really short of breath. It's hard to breathe, and I got this. My leg is just killing me. I feel like I'm getting stabbed in my leg. My toes are numb. It's weird. Never happened to me before.
I understand. It's probably a scary situation, but we do have help on the way for you, okay? I won't leave you until they get there.
Oh, thank you.
You're welcome.
Oh, I think I can hear them.
Okay. Just keep me on the line till they're actually there with you, okay?
Okay. Are they going to make me go to the hospital? I don't have insurance.
Okay. Well, as far as that goes, I can't speak to insurance, but if they recommend you go to the hospital, it's probably a good idea that you listen to them. They are professionals in this, okay?
Okay.
But, they'll advise you on the most appropriate course of action.
All right. Thanks for your help.
All right.
Appreciate it.
That's okay. No problem.
Okay, so what you just saw was the interaction between a dispatcher and the patient. So, as I've said earlier, our times have changed. The face of EMS is changing, and so too is the interaction between the dispatcher and the patient. Take note of the different questions that the dispatcher asked, as well as we asked the patient to walk outside or go to the front door. We also advised the patient that we will be wearing PPE, or we'll be looking a little bit different. These are all things that are leading up to some of these changes that we've been talking about, and who knows how else our dispatching will change from here on out.
I think they're here.
How you doing, sir? You can hang up. My name is Chris. I'm here to help you. What can I do for you?
Yeah, my leg hurts. Killing me.
Okay, I have a few questions to ask you. Have you had any recent fever?
I think so. I don't know.
Okay, how about respiratory problems? Any shortness of breath, cough, or flu-like symptoms?
Yeah.
Okay. Have you had any contact with anybody that is confirmed or suspected COVID-19?
I mean, I don't know. I go to Walmart.
Okay. Okay. Have you had any recent nausea or diarrhea?
Yeah.
You have?
Yeah.
We're going to step back and put a little bit more PPE on. We're going to be right with you and take good care of you, okay, sir?
Okay, man. Thank you.
Billy, full PPE.
Now that was a fantastic 6-foot standoff. Notice the questions that were asked, they were clear, they were correct, they were perfect. Now imagine you were the patient. What is the patient thinking about us as we approach them, looking the way we look? We don't look that normal anymore. Now imagine if that was a child and now we're standing 6 feet away and we look very odd with all of this stuff all over our face. We understand that. What we're also asking for you guys to do, for everybody to do, is to acknowledge that our patients may be looking at us very strange. We look strange and then we're asking them to come with us. Something almost out of a sci-fi movie, if you will. Just, again, recognize eye contact is extremely important here, which is recognize that eye contact is the first step to gaining trust with your patient.
What's going on today?
Now take a look as he performs his assessment. What kind of differential diagnoses is going through your mind with this patient? This is a 30 to 40-year-old patient complaining of leg pain, a little nausea, a little vomiting, and a little bit of weakness, numbness in his leg. Now, is this patient presenting with possible COVID? Yes or no? Is this patient possibly having an MI? Yes or no? Is this patient possibly having a stroke? Yes or no? Talk amongst yourselves. What kind of differential diagnoses could this person be having? Is this person too young to be having any of the things that I've already listed or not? Think about it as we continue looking at the rest of this assessment.
Leg. I feel like I'm getting stabbed behind my knee.
Partner says that you're having some flu-like symptoms. I've got a mask here I want to put on. This is for our protection and yours, okay?
Okay.
How long have you been feeling like this?
A week.
Like a week?
5 days, 3, I don't know. About a week. It got really bad the last couple days.
Really bad last couple days? I'm going to take your blood pressure. Anything else bothering you today?
Just like my arms just like weak, my legs kind of numb, and just this pain, and it's hard to catch my breath.
Gotcha. Hey, Chris.
Yeah.
Can you get me an IV setup and an AccuCheck?
What causes leg pain like this, man?
I'm sure, man. We're gonna find out now. All right, good. So you got numbness, you said, on the right side. You complain of a headache?
No, it's my left side. Yeah, I've had a headache and been nauseous and
Okay.
throwing up the last couple days, but it's just this pain in the back of my leg. It's just like my toes are numb and it's hard to walk.
Okay, what kind of medical history do you have?
None.
None? Do you take any medication?
Nope.
Are you allergic to any medication?
Not that I know of.
All right, we'll be right back and I'm gonna get some equipment, okay?
Okay.
Now that we've had an opportunity to see the assessment in its entirety, what are your thoughts? Do you see where there might be some areas here where crews might take a nonchalant attitude? You just have a young male complaining of leg pain, little nausea and vomiting, something along those lines. There was a lot of information in that assessment, information that should have led you down many differential diagnosis paths.
Hey, Brad. Hey, I got a possible CVA here. So you can do a quick fast ED.
Absolutely.
And let me know if we're going to call stroke. So that's when we get an AccuCheck while we're doing it. His vitals are a little bit hypertensive at this time. His pulse is a little low. So if you can just do that fast ED read real quick, and then we'll make that decision.
Okay. Sir, can you hear me?
Yeah.
Can you squeeze my fingers? I'm going to have you put your palms up, hands by your side. Try and hold them up like you're flying with your eyes closed. Like you did, what? Now repeat after me. You can't teach an old dog new tricks.
Can't teach the old dog new tricks.
Perfect. Look at me. Try and follow my fingers. Perfect. Can you feel me?
Feels weird.
How about this side?
Yeah.
This one's different?
Just feels like pins and needles on the left arm.
Perfect. We're going to get the stretcher ready to get you loaded up.
Okay. What's wrong with me, man?
My partner say you have high blood pressure?
I don't know. Never had high blood pressure before.
Any headaches?
Off and on for a couple days.
Blurred vision?
Yeah, a little bit.
Feel like you're going to pass out?
Now, the purpose of showing this video was to show that even in times of COVID-19, it is still important for us to do accurate and good patient assessments and actually treat our patients. Just because COVID-19 is here does not mean that it allows us or grants us permission not to properly assess or treat our patients. We still assess them, and yes, we still treat them. We still start IVs, we still place people on cardiac monitors, we still need to be the diagnosticians that we are. This was a good example to show a young person possibly having a stroke, being treated, and still also having possibly COVID-19. It should not bar us from treating our patients. Now let's talk a little bit about communication and how challenging our communication has been over the past couple of weeks and months. As a matter of fact, the past few months have been some of the most challenging and emotional times for so many people inside and outside of our profession. This makes the way we communicate with each other and our family and our friends that much more important and critical. As you know, people deal with stress in a multitude of ways. We, being in fire and EMS, we're used to dealing with high levels of stress, for the most part. Now, take a moment to imagine those people that are not used to dealing with high levels of stress. And now they're having to have to deal with the loss of job, loss of revenue, screaming kids. Yeah, anyway, the point is, good reflective communication has to start with us. It has to start with us. Now let me ask you, overall, how well do you feel that we communicate with each other on a shiftly basis or on a daily basis? How well do you feel that we communicate with one another? I can tell you that in my 30 years in this profession, I feel that sometimes we treat each other in a very unkind way. Many tend to hold grudges. Some are revengeful. Some have an extremely hard time letting go of things. And some, well, they have a combination of all three or more. Many times, we're not careful with what we say and how we say it. And think about it. This spans rank or hierarchy. This spans throughout rank or hierarchy. From the newest personnel to our most senior personnel, and well, sometimes they're worse. From fire chief to fire chief, from administrator to administrator, from fire chief to administrator and back, from director to director, from director to administrator. It doesn't matter. There are no boundaries. Sometimes we are very quick to react with emotion, and that emotion can sometimes be anger, judgmental, spiteful, or worse. I tell you this for the simple sake of awareness. That's all. Awareness. Again, good and reflectful communication starts with us. If we can't communicate well with each other, and we proceed to be rude or mean or inconsiderate, etc., then how will this translate to our patients and their family or friends? Or how will this translate when we go home with our family and friends? Now, take it to another level, and that we all look like aliens with masks and goggles and booties. It can all be very, very unnerving. Now that said, when we're with the public, either through patient contact or just on a normal level, what I'm asking is that you take a moment to reflect. Be nice. Be compassionate. When you feel yourself getting stressed, take a step back, take a deep breath, and think about what you're about ready to say and how you're about ready to say it. Think about what you're ready to do or not do. Try to understand that your patient may have just lost their job, lost their revenue, or maybe dealing with something far worse than you are able to comprehend in a manner in which you may not be able to understand. Remember, people handle stress in different ways. Some may lash out in anger. Others may be simply afraid and may be communicating that fear in a less than perfect way. Look, sometimes this job just sucks, as it is riddled with complexities and challenges that many in our lifetime couldn't imagine. And yet, each and every one of us get up every morning or every evening and we do it. We all have come to work, and we continue to come to work, to treat our patients, to run calls every shift. We're answering the call, and we have answered the call. It's incredible, in fact, how well we all have responded. It's absolutely incredible how well we have all responded. Each and every one of you are very important, both on a personal level and on a professional level. On a personal level, you are very important and needed by your family and your friends and all those that you encounter. On a professional level, you are important and needed by your coworkers, by staff, by neighboring agencies, and patients, and their family and friends, etc. Just to name a few. To that end, you are all very, very important and very, very needed. Because looking towards the future, we can expect to see an increase in call severity and call volume. I want to take this time right now to personally thank each and every one of you. I know every member of our unified command wants to take this moment to thank each and every one of you. And I know that every member of our local government wants to take the time to say thank you. You have to know how much we care. I've been doing this for a long time, and trust me, I care. We all care. Thank you for the jobs that you guys have done. And thank you for the jobs you're about ready to do. Be safe.